So I'm going to be discussing the psychospiritual approach to therapy. Again, we've heard a lot of presentations this morning so far from medical professionals and those who are researchers, PhDs, who provide research based on various medical conditions. But I really want to put everything in context because spirituality can be a very significant and integral part of all of the presentations that you've heard. So even though I'm talking about psychological services and therapy, I really want you to also apply the concepts and the ideas to your medical professionals and the work that they're doing when they're providing services. So what are our objectives this afternoon? First, I'd like to address this topic to the professionals, the healthcare professionals, as well as to all of you who are here, the clients and potential patients of medical professionals and psychologists such as myself. I want to empower all of us to be able to ask the right questions, to have the right expectations, and to be empowered to recognize that spirituality can actually help prevent and also help to fight against and aid in the healing and recovery process of some of these other medical conditions, in particular cancer. How many of you would say that who have know someone or who is a cancer survivor yourself, experience belief in prayer or God or higher power? And yes, just about everyone's hand is raised. And I'm going to show you why that question is so significant and so vitally important that we ask. So first, I'm really wanting to address the professionals as well as our community at large and recognizing the relevance and the utility of an integrated model. So what do I mean by an integrated model? I'm talking about every kind of treatment that you get is you're integrating your belief system in it. That's something that can be done, and by the end of this talk, you'll know how to do that even more so. I want to assist the health professionals to more effectively assess their patients, their level of spirituality and where their beliefs are. I want to encourage us to be able to increase our awareness of the evidence revealing positive mental health effects as well as positive physical health effects related to an integrated model. And then also, I'd like to assist the healthcare professionals in the application of patient spiritual values in treatment. How do we do this? How do we talk about it? Especially recognizing that in our culture, spirituality and religious talk and God talk is being constantly removed out of our systems, being removed out of our educational systems, out of our political systems, out of all of these other systems. How do we integrate it? How do we bring it back in confidently? That's a question that we have to be confident in being able to respond to. And then lastly, raise and promote the observation of spirituality as an integral and necessary part of what we call being culturally competent. So we as healthcare professionals are always interested in being culturally competent. And spirituality, as we will learn we'll define it a little bit later on, is an issue of cultural competence. So what's our role? What's our purpose? As I mentioned before, the stigma and the mental health associations related to a diagnosis of cancer immediately can present an enormous and frequently emotionally, psychologically, and physically debilitating response in a lot of people, and most people. Meaning this, you just hear the word cancer. Oh my gosh, what does that mean? It means culturally, we have defined it, and culturally, we have an expectation. Whether it's true or not doesn't matter. Our expectation and the fear is, oh my gosh, death, pain, body change. But all these different kinds of images immediately come to mind. And I'm bringing that to our attention because the immediacy of it coming to our minds also means the immediacy of some of these neurotransmitters and chemicals that some of the medical doctors can expound on a little bit more that are being released into our bloodstreams. And these levels of hormones and negative hormones, and not necessarily that they're negative in and of themselves, but having high levels and for a long duration period of time, that's not healthy. And that creates some of the more chronic and the chronicity of severe medical conditions, which we'll talk about a little bit later. So diagnosis of cancer has both personal and cultural meaning and interpretation, particularly for those who have experienced in their families breast cancer or various other types of cancers that, once again, immediately think about the negative result being death. And I'm using that word because we've got to be frank and we've got to be honest and how this impacts us psychologically. So this is the impact specifically of breast cancer, being that that's kind of the focus this morning. We've got a lot of women and working with Ernesta, worked with her for the last couple of years. I met her and I know that the focus is on various forms of cancer, but particularly for women, breast cancer. So a diagnosis generally evokes a wide range of emotions. The first one being fear, as we mentioned. That denial oftentimes is presented. So we go from denial to maybe anger that there was a diagnosis, anger that how did this happen? Why did this happen to me? Did I do something wrong? Is God angry with me? Is it running in my family because of historical things that have happened that my family members have done, and I'm reaping the harvest of that? All of those different kinds of thoughts are going to impact the level of the recovery process over a period of time as we dwell on these kinds of thoughts. So maybe we go from denial to anger, and then depression, and after depression, eventually the hope is that we come to a place of acceptance of the diagnosis. Why is acceptance so important? Because it enables us to be able to seek out the treatment that we need earlier, sooner rather than later. Because oftentimes, particularly in the African American community and minority communities, we don't seek out medical treatment because we're afraid. We're afraid of the outcome. We're afraid of maybe the financial resources that we may not have, or afraid of how the treatment is going to be different to us based on what Dr. Schlitz, I believe his name was, mentioned, and the diversity and the variances in treatment and how African Americans and various other minority groups are treated in research, clinical trials, and those kinds of things. So there are a number of culturally based concerns and fears that we have that may prevent us from seeking out the treatments that we need. Shock and denial, guilt and blame, anxiety, depression, these are the things that we as psychologists think about. Because that's when clients come into our office or patients come into our office when there's anxiety, unexplained, depression, feelings of isolation and confusion, and prolonged periods of time, then we like to tag on a clinical diagnosis. Major depressive disorder, anxiety disorder, all of these different things that are also directly linked to medical conditions. And I'll talk about that a little bit more. We also view, as we mentioned, I don't really need to, we mentioned that fear, possible changes in body images, feelings of powerlessness. This here is vitally important. Unanswered questions because we don't have resources. We don't know what the process is going to look like. The process of the medical problems or the medical conditions. What kinds of treatments am I going to receive? Is the treatment going to be effective? How long is it going to take? What's going to be the ultimate impact on me and my family and my household once I've been diagnosed with breast cancer? And these are the questions that, once again, pose very personal and have cultural meaning. And this was based on research that was provided by Worthington and Sandage in 2001. Now, more specifically, the role of the healthcare profession. What ultimately, I'm aware of our time, so I want to make sure that I get through the slides that are most important. I would like to encourage that our responsibility is not just to look at dysfunction and dis-ease, but our responsibility is also to look at protective factors. That has to be an integral and necessary part of whatever treatment that we are taking part in as health professionals or as patients or clients. We've got to empower ourselves to recognize that it's not just taking a look at the weaknesses, but also looking at what are some of the strengths. And that is why I'm here to propose that spirituality and that belief system is one of the most significant and important strengths that we can offer into any kind of recovery process. If we call ourselves helpers, then we've got to do this. Now, this diagram is a diagram that I put together because it signifies the transition and the changes in the viewpoint of religion or spirituality, we'll find it in a few minutes, throughout the history in psychology and within the medical field. What this says is we used to view this integration as unreliable. I'll explain why. Because it's non-empirical, even delusional, therefore ultimately it's problematic. What this means is maybe around the end of the medieval periods, when we really respected a lot more, not that we disrespect them now, but we had a lot more respect for the philosophers and the academicians, mathematicians, people like Rene Descartes, Hume, various philosophers that helped to establish our viewpoint in Western thinking and Western society's way of interacting with medicine and science and psychology and those types of sciences. So what am I saying? That years ago, during the end of the medieval period, the view was that if we can't test the research, if we can't empirically identify what's taking place, we're not going to embrace it. We're not going to use it. It holds no relevance. Therefore, it's insignificant. Spirituality, religion, was viewed as being unreliable because we can't test it. We can't see God. We can't feel God. We can't see spirit. We say spirituality. We say we're spiritual beings. Can't test it. Can't prove it. You can't put it in any kind of a clinical trial and say with certainty that it is there. So what do? Not empirically based. Therefore, Freud thought that people who embraced a spiritual viewpoint, a belief, that they were delusional. He actually Sigmund Freud, this is one of the main foundations of psychological thinking or analytic thinking.